Half hidden at the end of this road is what was one of Venezuela's most respected psychiatric rehabilitation centers. Now, the only person left there is Bernardo Arciniegas, the watchman for the last 15 years. Why did they close the institute, I ask?
Because there was no medicine or food, there used to be 300 patients. But in May, the last 50 were transferred.
Dr. Felix Velasco worked at the institute until the last day. And he tells a disturbing story, documented with shocking images.
It began 5 or 6 years ago. The state and national governments started cutting the budget. Half of the 300 patients were released to their families, but the rest had nowhere to go. They began dying from starvation. Eventually we had 110 left, and insufficient funds for food or medicine. Between 45 and 55 more patients died of starvation, especially in the last 2 years. These photos show you patients who once weighed 110 kilos and ended up weighing 40, left with just skin and bones.
Dr. Velasco says there was nothing they could do but transfer the remaining 50 patients to another institution in northern Venezuela. He's been told only 9 survived. The psychiatric wing of San Cristoba's General Hospital, the only place now left in Tachira state for mental patients, is another testimony to the crisis in Venezuela's health services.
Not only doctors and nurses, but also maintenance staff have left, because our salaries aren't enough to survive.
The wing was designed for 60 patients, but with the acute shortage of personnel, it could only accept 8, and only those whose families can supply their food and medication. The facilities are in a dilapidated state, including the isolation cells for patients who become violent. Many no longer have locks.
A lot of patients have escaped through the ceiling.
All over Venezuela, mental health institutions are struggling to provide sufficient nourishment and essential medication to ease patients' suffering. The government blames U.S. economic sanctions, but Dr. Velasco argues the decline began long before they were imposed.
I never thought I'd see this in my life in a rich country like ours. I personally wrote 45 death certificates for patients who never should have died.
And as Venezuela's political and economic crisis worsens, it's almost certain they will not be the last. Lucia, Newman, Al Jazeera, Venezuela.